Hi, thank you for watching Digging to China. I'm Dong Shuang. If you have not done so already, please subscribe to my channel. Thank you very much. Just weeks after China ended its zero COVID policy, Dr. Xu Zhuping and her outpatient department find themselves confronting an unprecedented crisis. The team in Shanghai is treating up to 600 patients a day, almost 20% more than the same period last year, Xu estimates. And what was worse, they had to do so with 4 out of 6 doctors infected with COVID-19. Dr. Xu told a Chinese news media outlet Six-Tong, "I've worked at this hospital for over 30 years, but I've never seen the emergency room as busy as it is now. Ambulances keep arriving with people in a critical condition. When I treat my patients, I constantly worry about whether there are enough seats in the infusion center." By the way, Dr. Xu Zhuping is just a pseudonym she used to protect her privacy. Hospitals all over China are struggling to cope as a wave of COVID-19 infections rips through the population. Doctors describe shocking levels of overcrowding, shortages of key supplies, and medical teams weakened by mass infections. It's unclear how many people have been infected, but local authorities estimate that the case numbers in Shanghai alone have surpassed 10 million. A surge in hospitalization followed. According to China's Health Commission, around 8% of COVID-19 patients in China developed pneumonia in 2022. Though this appears to be a relatively low ratio, it translates into a huge number of people with lung infections due to China's vast population. By the end of December, Xu's department was already receiving record numbers of patients. Most of the patients are in their 80s and 90s, and the vast majority have pneumonia, she says. The hospital's emergency room has been completely overrun. Given the crisis at the emergency room, we can no longer transfer patients for hospitalization. The few remaining beds in the inpatient department are reserved for patients from the emergency room, she says. A few days ago, Xu was treating a patient with a serious heart condition who required immediate hospitalization. But the overcrowding in the emergency room had become so severe, she was physically unable to enter the department. "I tried to communicate with people at the emergency room face to face, but I failed even to get through the gates," says Xu. There were just so many people in equally dire conditions. The way in and out of the room was blocked. The crisis isn't limited to fever clinics and emergency rooms. Intensive care units have also struggled to cope. Many hospitals have mobilized all inpatient departments to accept pneumonia patients or those with other diseases triggered by COVID-19 infections. Junior doctors especially were unprepared for the crisis. Just last month, 26-year-old Ma Jingyan became an independent resident doctor at the gynecology department in the Shanghai University-affiliated hospital in Xining. She could not have foreseen starting her career under such conditions. By late December, even the gynecology department at her hospital was tasked with treating a dozen senior patients with severe lung infections. "I'm worried about losing lives," Ma said. "My department seldom deals with death. I understand medical workers need to face death, but when you personally need to deal with it, it's another thing." Ma didn't sign up for this. After interning in Shanghai, she chose to settle down in the best hospital in her hometown, believing it would provide less stress and a decent income. Weeks later, she found herself on a brutal night shift on New Year's Eve. That night, Ma was tasked with treating a patient in her 80s who had a severe lung infection. As her condition worsened, the woman started to panic and faded in and out of consciousness. Ma, who had no experience treating lung infections, was terrified. Time passed so slowly that night. Amid a staccato of fireworks outside, I waited nervously for help from the intensive care unit, she recalls. But the ICU staff were receiving requests from every department in the hospital. I had to keep begging them for help, Ma says. Finally, her colleagues from the ICU told her that the only way to alleviate the old lady's symptoms was to clear the phlegm. We couldn't intubate because there weren't enough life-supporting machines in the hospital, Ma says. I had to tell the patient's family the truth to mentally prepare them. The young doctor didn't dare leave the sick lady's bed. After hours of clearing the congestion, the woman felt better. She was lucky to pull through, says Ma. If it had gotten any worse, the consequences of giving the frail lady CPR would have broken ribs. Moreover, the effort may not have necessarily saved her life. After that nightmarish shift, Ma was given a full day off. She still hasn't fully recovered from COVID-19 herself, having tested positive on December 16. Unless she's relaxed or sitting still, her heart rate easily clocks 100 beats a minute. Honestly, I now regret my choice to be a doctor, she says. I struggled even when I made the decision. I knew I would deal with many challenges, but I just didn't expect it so early into my career. Back in Shanghai's Chongming Island, Dr. Xu Zuping was among the 4 doctors who contracted COVID-19 almost at the same time late in December. That was also when patients started to flood into her hospital. On the front lines, she witnessed firsthand the crushing demand on doctors. Her 2 colleagues had to treat over 500 patients a day. They were forced to extend their service hours too. While they once started at 8 a.m. and finished at 4:30 p.m., they were now receiving their first patients as early as 7:30 a.m. and clocked out at nearly 6 p.m. Xu took 4 annual paid leave days to recover, she said. I didn't ask for sick leave because that would have meant a deduction in salary. I had many annual leave days which would otherwise go unused. I originally planned to take 2 days to leave out, but my body kept shaking. The team is also facing shortages of crucial medications such as Paxlovid, an antiviral produced by Pfizer that is effective at preventing severe COVID-19 symptoms. With no Paxlovid on site, Xu's team has had to experiment with alternative treatments. They have tried prescribing a cocktail of other antivirals, antibiotics, and hormone drugs. Though these treatments are rarely used in better supplied hospitals, Xu says they are proving effective in practice. Theoretically, it's a viral infection, says Xu. In practice, many of our patients have used antibiotics and hormones. They did work. This approach remains controversial in China. Experts at leading Chinese hospitals insist that doctors should only use antiviral treatments and avoid prescribing unnecessary medication. Doctors in undersupplied areas, however, consider this unrealistic. For Xu, the alternative treatments are better than nothing. We are a rural hospital, she says. As long as our patients feel better, it's a feasible practice. At the end of December, the City Health Authority awarded all frontline medical workers 6,000 yuan for their contributions in the fight against COVID-19. A few days later, Dr. Xu from the Chongming Hospital also received a gift package of 30 eggs, 12 apples, 12 pears, and a piece of preserved pork from the local government. With or without such rewards, we'll continue treating patients no matter how many of them come. It's our job. We've got used to it, she says. I want to say Happy New Year, the Year of Rabbit, to all, especially to the frontline medical workers. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.